Dr. Sharad Damodar also is the Hematology and BMT at Narayana Health City, Bangalore. And I would also like to call Mr. Hamza Khan, who is a survivor of relapse of cancer.
Cancer treatment now what is talking about immunotherapy, which means we are moving away from chemotherapy, which was the standard treatment for cancer, which has a lot of side effects and toxicity and all that, and we are talking about immunotherapy. The big highlight of immunotherapy is trying to use your own cells to fight the cancer cell and destroy the cancer cell. So that's the newest treatment, and then we've been seeing news about various centers trying to start this. From the patient, the T cells you collected when they're well, change one receptor so that can identify the cancer cell and then put the cell back. Then that will go back and kill the cancer cell in the patient. Okay. So now this is the latest form of treatment for cancer everywhere in the world, and in the US a lot of patients have started getting this, but it is something which is horrendously expensive in the country. And for us to be for it to be affordable to our patients, when it happens in our own country, the cost will not come down. And the classic example is for bone marrow transplant, which we anyway got proof now that earlier what used to cost 1 to 2 crores in the US is now available for 1/10 of the cost in our country. And there are close to about 100 centers in the country doing bone marrow transplant now. Even 20 years ago when I started out my practice, there were less than 10 centers in the country who could do bone marrow transplant. So using that, looking back on the treatment, Mr. Khan will tell you what exactly he had to go through. So, all of us remember our COVID pandemic. We were keeping, social distancing, masking, all, housed up in our houses, locked down. So, and say, I will not do anything, you need to get treated, And he's somebody who went through that kind of treatment, then came out of that, but unfortunately had a relapse again. And when it relapsed again, even the chemotherapy treatments were not working. So at that time, we got him to come into our center, and at that time this kind of treatment was being initiated for the first time in the country, and he was eligible to kind of undergo that treatment, and his cells were collected and then put back, and he's now one of the longest survivors now, definitely in the state for sure, that I'm sure. He's also one of the longest survivors in South India, because there's no other patient from South India who's got this kind of CAR T therapy. He crossed 1.5 years, and his recent tests and blood scans and reports and all are absolutely normal. So in diseases like cancer, we have milestones, so everybody talks about the first 6 months survival, 1 year survival, 2 year survival, and then you want longer 5 year survival, and after that it's basically cure. So we are looking more and more towards that kind of, milestone in him, and that's why it's a big moment for us to say somebody who's crossed that, first of all, the 1 year landmark, and now he's actually beyond 1.5 years. So for more people in our own country.
So as a disease itself, if you consider, it is around 3.5 years. So before getting into this immunotherapy or CAR T cell specifically, so the normal treatment regimen I underwent in one of the leading hospitals in Bangalore. So it gave a result initially, but in a matter of 6 months, it relapsed again. And I was going nowhere. And one of my close family doctor has suggested that you have to go to the best, who is at the best in immunotherapy as well as the BMT. Then only I came across Mr. Dr. Sharad Damodar. So I went to him. So before that, the typical regimen in chemotherapy was like you lose your hair, lots of side effects, you will not be active in your day-to-day life, and all that stuff I underwent for almost 2 years. Then after coming across Dr. Sharad Damodar and his team, then they have enrolled me into this CAR T cell. So I would say, as far as the CAR T cell therapy is concerned, not every patient can be enrolled. There are certain selection criteria is there. So I have crossed that, or I have passed that selection criteria. Then they have enrolled me. So my experience with this treatment regimen is, I would say, very, very limited side effects. Rather, I would put across zero side effects. and I have started my day-to-day normal life, and then I usually followed. There are no, I would say, the outcomes of the protocol was also found to be very normal. So I would like to express my with a deep sense of gratitude, my heartfelt thanks to Dr. Sharad Damodar and his team that they gave me a second innings in the life, and thank you very much for adding more years into my life. So that's what
We wanted to do, which otherwise with disease progression and being on treatment was something which
then followed by whatever you take, you used to vomit or you used to puke. So I have to undergo emergencies, surgery. So there are no well-defined symptoms as well as the puking.
vomiting.
Vomiting.